Hi, my name is Chris Wilder, Executive Director of the Valley Medical Center Foundation. But I'm here today to encourage you to vote yes on Measure A. We have an opportunity this November to protect some of Santa Clara County's most important services, some of which you or someone you love will need sooner or later. Currently in our county, the economic downturn has resulted in substantially reduced revenues from falling property taxes, falling state sales tax, and state and federal budget cuts. It's all led to a smaller allocation of funds to counties and cities. This reduction in revenue has resulted in 10 straight years of budget cuts to the county's general fund, totaling more than $2 billion. Now, the county's leaders haven't sat idly by while this problem gets worse and worse. Over the last 10 years, our supervisors have drawn down budget reserves, deleted positions, employed technology to create savings through greater efficiency, while thousands of doctors, nurses, firefighters, and the guy who keeps the office clean have all accepted cuts in pay and benefits. Let me back up a moment to remind you what the county actually provides for us. First, the county is responsible for much of the safety net in our community. That's Valley Medical Center and the county's health and hospital system. Valley Medical Center operates a top-level trauma center and burn unit for the Bay Area, a world-class spinal cord and brain injury rehab center, a hospital and clinic system that will see at least 1 in 4 of us in Santa Clara County, mental health support and protection from infectious disease, emergency preparedness, and a lot more. A few statistics on the health system from last year. 72,000 people were treated in Valley Medical Center's emergency department. 23,000 were connected to needed mental health services. We monitored 95,000 ambulance calls and cared for over 1,000 people with spinal cord and brain injuries as well as strokes. Investigated 954 people suspected of either having tuberculosis or coming into contact with someone with tuberculosis. And over 250,000 people were cared for and treated by the county hospital or community clinics alone last year. So the bottom line is this: it doesn't matter where you get your regular health care. With the trauma and specialty services that the county provides, you or someone you love will likely need Valley Medical Center at some point. And the budget cuts have been deep. That's why we need Measure A. Of course, the county does so much more. It also provides law enforcement with the sheriff's department and jail, health coverage for kids and low-income families, parks and trails, social services, all sorts of things. The language in Measure A reads as follows: shall the County of Santa Clara enact a 1/8 cent sales tax that cannot be taken by the state for local priorities such as law enforcement and public safety, trauma and emergency room services, health coverage for low-income children, economic development and job creation, housing for the homeless, and programs to help students stay in school, all for a limited period of 10 years with annual public reports to ensure fiscal accountability. That's it, simple and to the point. 1/8 of a penny tax increase for just 10 years to protect essential county services. We just can't rely on the state and federal government to provide services we need here in our county. Washington and Sacramento, they make cuts based on their priorities, not our priorities. Measure A will generate funds that cannot be taken away by the state. They can only be used for essential local services. Measure A will help prevent cuts to the county's Healthy Kids program, which provides coverage for thousands of children who, before the program started, didn't have any coverage at all. Children with health coverage miss fewer days of school and show improvement in paying attention and keeping up with school activities. Measure A will support public safety and law enforcement programs that keep criminals off the streets. Measure A will support programs to help students stay in school and stay healthy and able to learn. Measure A will support controlling the spread of diseases like tuberculosis, whooping cough, AIDS, and H1N1 through early detection and immunizations. Measure A means we can count on these critical services for our local community. Join us in working to provide a healthy and safe quality of life for our county and vote yes on Measure A. Thank you.